came to see me a few weeks ago. What symptoms did you have?
I was having shortness of breath and pain in my right lower lung.
And how long had you had that for?
Probably a year. I was having shortness of breath a year ago.
What about the pain that you were having?
I've had that for a while.
Long
Yes.
time?
Yes, a long time.
And I assume over time you went to other doctors for evaluations?
Absolutely, yes.
What type of treatments have you had for that?
I actually, last year, they diagnosed me with pneumonia. I was started on antibiotic, and I went back 3 months after being on antibiotic, and they did a CAT scan.
What's that? Is that your thumb?
I started on a CAT scan. They did a CAT scan, and they thought this infection had spread, so they thought I had cancer. So I went to Georgetown and had a VATS procedure done, and they took out some tissue, and they found out that I had this inflammation, and the pulmonologist said that I had autoimmune disease from my stomach had spread to my lungs. So he diagnosed me with pulmonary fibrosis.
I see. And then you came to see me. We did some testing, which included a food allergy test.
Correct.
You stopped eating those foods, and what happened?
The shortness of breath went away. The pain went away. I went back to my pulmonologist, had some an x-ray done, which showed the inflammation had greatly decreased, and also I wasn't short of breath anymore. I did an exercise stress test, and I was fine. Where before I couldn't have done that.
So these problems you had for a while, the pulmonary problems, which was called pulmonary fibrosis, along with your digestive symptoms, went away without any drug therapy. Is that correct?
Correct.
And what's amazing about that, I'm an ear, nose, and throat doctor, and so many problems tend to occur as a consequence of food. And whether or not that's anything that I can point to as far as a change in the food, but certainly over the years, food, where it comes from, how it's produced, has changed and brought about some medical problems people are dealing with today.
Right, right.
Well, thank you very much for speaking with me today.
Right, you're welcome.